Hey everyone, welcome back to InsightRx. Today we have Dr. Ankit Patel, who's a double board certified physician in physical medicine and rehabilitation and brain surgery medicine. He practices at Duke University Medical Center at Orthopedic Department. He grew up in a family of medical practitioners, which has inspired him to pursue a career where he could make a positive impact on people's lives. He believes it's important to enrich an individual's health hospitality through individualized treatment plans. He focuses on improving quality of life with goals determined by the patients themselves. He treats the scope of physical medicine and rehabilitation and is always seeking to learn more. Additionally, he's the co-founder of a nonprofit school for children, the Ethos School, and enjoys time in nature and playing any sport and spiritual pursuits. Welcome to our podcast.
Thanks for having me.
Let's first start off talking about how you really went into physical medicine and rehabilitation. So, what inspired you to choose physical medicine and rehabilitation and later brain injury medicine?
Do you want the long version or do you want the short version?
Whichever
is
one.
fine.
So I'll try to keep it semi-brief. I guess growing up, my father, he's a physician, as you mentioned. My grandfather is also not a physician in terms of allopathic medicine, but he was a big believer and a practitioner of Eastern medicines, most commonly known as Ayurveda. But in addition to that, he practiced other forms of integrated medicine, such as Reiki and acupressure as well. So I've always been around that atmosphere, always been around that environment. And I think it was just something that was natural. So I don't know if I really had an epiphany moment that, yes, this is what I want to do for the rest of my life, but it's just something that I was always exposed to and thought that would be a great way to serve humanity, to serve people. And so that was my initial calling to medicine, I think. And then physical medicine and rehabilitation specifically, I think I was introduced to in about the third year of medical school. At that time, I was always interested in neurology, but I felt that I wanted to do something a little bit different. And physical medicine and rehabilitation allowed me to focus less on diagnosing and more on recovery, rehabilitation, outcomes, functional outcomes, and just quality of life in general. So not saying that neurologists don't do that, but the emphasis and the focus of the specialty is catered towards that. I think that's what led me to this field in particular. It also allowed me to utilize a lot of different tools. I enjoy integrative medicine, as I mentioned, and so it allowed me to incorporate a lot of integrative medicine into what I do. And then additionally, the work-life balance. And so, I have kids, other interests as well. And so for me, a specialty that didn't demand me being on call 24/7 was attractive. And so probably those are probably the main reasons that I chose to pursue physical medicine rehabilitation specifically. And then brain injury medicine, I think that was just more from an interest perspective, I think. As I mentioned, neurology was something that I was always interested in. I think it was just intellectually stimulating for me, brain things. And so brain injury medicine was a way to dive a little bit deeper into brain things while still being in the specialty of physical medicine and rehabilitation.
In your practice, what does quality of life really mean, and how do you help patients define it for themselves?
Yeah, good question. So, quality of life is very subjective, and for different people, that means different things. So, for example, if I could have two patients that have right-sided weakness, or they may not be able to move their right side of their body, and for one of them, quality of life could really mean being able to feed themselves. Like that's really something that they find important. It's something that they feel is very satisfactory to them. And for someone else, same disability, it may be being able to walk. So quality of life is determined by the individual or by the patients themselves. And so me helping facilitate their recovery and cater the treatment plan based on their goals and obviously their shared decision making as well. So I let them know, for example, if it's someone who just wants to feed, I also let them know that, hey, we might be able to walk as well. But ultimately, the decision is theirs. And based on what they choose or what they want to pursue, that's where we focus our treatment plan. So quality of life, I think, is variable from person to person. Whatever it is for that individual, helping to maximize that and optimize that as much as possible, whether it be through pharmacology, whether it be through equipment, whether it be through therapies, lots of different means and resources that we have available to us, trying to find what's best for each particular individual and create a plan accordingly.
How has your work at Duke shaped your perspective on healing and recovery?
So I think Duke's been a great place to work, and I think it's provided me with a lot of resources to be able to do a lot of the things that I want to do. So, for example, a couple of clinics that I'm involved with is a multidisciplinary limb loss clinic and a multidisciplinary neurodevelopmental clinic. Both of those are multidisciplinary, but what that means is it's multiple specialties, if you will, that come together and collectively talk about a particular individual and approach it from different perspectives, different aspects, and as a result, create a more holistic, comprehensive plan. And so that might be physical therapy, occupational therapy, speech therapy, dietitian, social worker, neurology, orthotist, prosthetist, nursing, case manager, social worker. So all of us, I think, coming together and being able to talk about a specific individual and cater the plan toward that individual is very helpful to the patient and I think enriching as a physician as well.
Hmm. So staying in the same ballpark, can you share a story where a patient's journey truly changed how you see medicine?
Yeah, I'll give you a small example. Small in terms of I think when we think of things in medicine, we tend to highlight radical changes or things that are measurable, often quantifiable. And this isn't necessarily one of those, but I think it's meaningful nonetheless. So what I mean is typically when someone is not able to walk and then they're able to walk, or someone has a brain injury and then you do surgery and then they're awake again. All of those things are obviously extremely important. That's not what I do, but nonetheless, I still find it meaningful. So the example I'm about to give is along those lines. So I had a patient that probably, it was probably a couple of years ago, and the patient was maybe 14-ish at the time, and the person was born with cerebral palsy, which is a congenital diagnosis, and had trouble moving the right side of their body. And one of the things that I do for intervention is injections, or specifically botulinum toxin injections, which loosens muscles. So this patient, they couldn't move the right side of their body and it was very stiff. It was very tight. And so they couldn't, for example, bring their arm out. And I did injections on this patient, botulinum toxin injections on this patient, and then I saw them back in follow-up. Botulinum toxin injections is not one of these injections that you do and you immediately see the benefits, in a couple seconds, but it takes a little bit of time. With a lot of things that I do, I think that's how it goes. So it definitely requires patience. When I saw the patient and their mother in follow-up, mother was crying. To be honest, my first thought was, oh man, what did I do? And then I probed a little bit further and I asked mom, why are you crying? And she said, for the first time in my life, my son was able to give me a hug with two hands.
Oh my God.
And so quantifiably, if you're marking it down on a piece of paper or if you're measuring it, it's very small or someone may even call it insignificant relative to the big things that may happen. But for that patient, for that family, for that mother, that's a game changer. That's a huge change in their quality of life. And so I think that stuck out to me, and that's a reminder that, while the things that I do don't necessarily have immediate impacts, and while they may seem small relative to the other things that may happen in medicine, they're transformative and they're incredible to those individual patients.
Yeah, that's really like wholesome and like
Mm-hmm.
inspiring. So, kind of staying on the same track, what challenges do you face when balancing patient-centered goals with medical realities?
I think that's a challenge, and I think those are always challenges that we face in medicine, whether it be patient-centered goals or even physician goals. Medical care, healthcare is changing, it's ever changing, and so there may not always be congruence in terms of opinions of physicians and outside physicians, whether it be insurance companies or whatever other entities that we may interact with. And so it's always important to be realistic. We may want something, but it may not always be practical, or there may be monetary limitations. Whatever the case is, it's always important to keep that in mind. And so creating a plan or talking to patients and talking through with what resources we do have available to us and trying to find a way to still achieve the outcomes that we want with or without those resources. And obviously, we often try to fight for those. So, for example, prior authorization is something we often have to obtain before we may do a particular procedure or prescribe a specific medication. And so we do our best to do those things. And if it requires an appeal, we try to talk to whomever it is that we need to talk to justify the needs of whatever our recommendations are. And sometimes it works, sometimes it doesn't. But whatever the outcome is, I'm still trying to find a path forward with or without said in plan A. So it's also important to have a plan B and sometimes even a plan C. But I think those are just limitations and realities that not just in medicine, but I think throughout whatever field you choose, that we have to live within the confines of.
How has being a part of a family medical practitioners influenced your journey? Like, did it add pressure, inspiration, or both?
Yeah, so definitely inspiring. So 100% inspiring. I think the way that I've seen my dad, the way that I've seen my grandfather, the way that they've carried themselves, their ability to
Mhm.
interact and influence, whether it be medically or non-medically, the lives of other people, was by far the first and foremost impression in my mind and image that I had of what a physician's life would be. So definitely inspiring. I wouldn't say that there was any pressure. I don't think that growing up anyone ever told me you have to be a physician. I think
Yeah.
people probably assumed that I would be a physician just because I came from a family of providers, but no one ever put that pressure on me. And to be honest, if I said I wasn't going to be a physician, I'm not sure what would have happened. But I think it worked out for everyone where that's where what I ended up doing. But no pressure and 100% inspirational.
In such a demanding field, what practices keep you learning, growing, and staying grounded?
So for me, you said learning, growing, and keeping me grounded. Learning, I think probably uh, we're required as physicians to continue to learn. So continuing medical education is what it's called. And so I think attending conferences, taking mini tests, if you will, doing questions, those types of things will continue to allow me to learn and kind of stay up to date on what's going on. Growing, I would say probably the patients.
Mhm.
So learning about the individual patients, learning about what's going on, what are their nuances, and trying to make sure that we do what we can to stay on top of things, oftentimes address things, but oftentimes prevent things as well. So that would probably be the growing and keeping me grounded. I would say spirituality. I think spirituality is definitely an important part of my life and remaining spiritual and implementing routine practices in my day to day life that keeps me humble, that keeps me grounded, that keeps me in touch with the things that are really important, that allows me to center myself and not get too distracted or too emotional or whatever the case may be, but allows me to just stay centered and stay as harmonious as possible. So I think those are probably the things that keep me learning, growing, and grounded.
That's very inspiring. So, on a ending note, what advice would you give to young people like us who want to make an impact in medicine but aren't sure where to start?
I would say explore. I think that, as growing learners, you guys have plenty of opportunities to explore, whether that be volunteering at a hospital or shadowing physician or research. Medicine is so vast and there's so many different ways that you can approach medicine and so many specialties. So yeah, I practice medicine as a physician, but there's nurses, there's PAs, there's nurse practitioners, there's optometrists, there's podiatrists, there's dentists, there's chiropractors, et cetera, et cetera. So the ways in which one can be involved in medicine and help another human being are plentiful. And even if you look at it from a technology perspective, so you could be in IT and be involved in like healthcare through electronic medical records.
Mhm.
There's lots of different ways. And so I would encourage you to explore the interests that you have and see if you can find a path that's already available or carve your own, because in today's day and age I think there's lots of opportunities to kind of find your own niche in the way you want to practice, and based on the things that you find interesting and appealing to you. And so finding what that is, and sometimes that involves a lot of experimentation. So just doing it or finding somebody that's already doing it, seeing what it's like, and then comparing what seems to speak to you more. Oftentimes what we may think is interesting, when we actually apply or try to practice it, ends up not being as interesting as we thought. And then sometimes we're surprised. So I would say that that's probably the first place to start. And then I think it kind of builds from there.
Thank you so much. Like everything you said gave a lot of insight and was really inspiring.
Thank you so much for letting us record you today.
Yeah, absolutely. Hope it was helpful, and wish you the best efforts in whatever you guys choose to do, and definitely however you choose to do it.
Thank
Thank
you.
you.